Hi everyone, my name is Bibi and I'll be talking about factitious disorder. So factitious disorder is a condition where someone fakes an illness to the point where they are deliberately faking symptoms, inflicting pain, and causing serious injury to themselves or someone under their care. This is with the primary goal of gaining the attention and emotional care of others around them. Factitious disorder is also known as Munchausen syndrome. So there are two main types of factitious disorder. These types are factitious disorder imposed on self and factitious disorder imposed on another. As the name pretty much describes, factitious disorder imposed on self is where one deliberately fakes symptoms and inflicts injury to themselves. On the other hand, factitious disorder imposed on another is where an individual purposely reports fake symptoms and illness on another. This is mostly seen in children, older adults, and pets, essentially in those who can't defend themselves or who don't know any better. So this is a brief background on factitious disorder. A fun fact is that this disorder was actually named after a German officer named Baron von Munchausen. He was known to embellish his personal history and fabricate stories. So the disorder was introduced in the DSM in 1980. However, the DSM-3 was later revised in 1987, and so was the criteria for this disorder. In the revised version, it was recognized that the condition can be presented as both physical and psychological symptoms. Later on, in the fourth version of the DSM, there was a more concise criteria for factitious disorder. This criteria, as seen on this slide, included the intentional production or pretending of physical or psychological symptoms or signs of illness, motivation to assume the sick role, lack of external incentive for behavior, meaning there was no rewards such as time off of work, time off of school, or monetary rewards. As mentioned before, factitious disorder has previously been recognized to present with both physical and psychological symptoms. Currently, there are four main ways in which this disorder may present as. First, it can be presented with mostly psychological symptoms. This is where an individual intentionally replicates symptoms of other mental health conditions such as schizophrenia and bipolar disorder. So an individual with mostly psychological symptoms may feign hallucinations, delusions, and depressive episodes. Next, the condition can be presented as mostly physical symptoms. These physical symptoms can include chest pain, stomach issues, and even fevers. It can also be presented with both psychological and physical symptoms. So an individual with both symptoms may experience hallucinations, or should I say report hallucinations, and report physical symptoms such as pain, bruises, chest pain, stomach issues, diarrhea, stuff like that. And lastly, there's factitious disorder not otherwise specified. This is mostly seen in individuals who impose an illness in another person. So the perpetrator may not have symptoms, but may report that their child or parent has symptoms. So in the fifth DSM, there are two criteria. The first criteria being for factitious disorder imposed on self. So as seen, this criteria includes falsification of physical and psychological signs or symptoms, or induction of injury or disease associated with identified deception. Also, individuals present him or herself to others as ill, impaired, or injured. Deceptive behaviors is evident even in the absence of obvious external rewards, such as monetary rewards, time off of work, being home from school, etc. And lastly, the behavior is not better explained by another mental disorder, such as delusional disorder or another psychotic disorder. Next, the DSM-5 also includes a criteria for factitious disorder imposed on another. This disorder is similar to the previous one, including falsification of physical and psychological signs or symptoms, induction of injury or disease, and associated with identified deception. The individual presents another individual, the victim, to others as ill, impaired, or injured. This is mostly seen in mothers who present their infants to others as sick. And this deceptive behavior is evident even in the absence of obvious external rewards. So sometimes these mothers don't necessarily seek any rewards, such as monetary rewards. And lastly, the behavior is not better explained by any mental disorder, such as delusional disorder or another psychotic disorder. So here we talk about the epidemiology of factitious disorder. So the nature of factitious disorder makes it hard to determine how prevalent it is in the general population. However, according to the DSM, approximately 1% of patients in hospital settings reach the criteria for factitious disorder. It's commonly seen in these settings, such as hospitals, and commonly seen in healthcare workers. The few studies that have explored this disorder indicate that factitious disorder is seen in approximately 0.8 to 1% of psychiatry consultations. Even more, the study shows that 2.2 to 9.3% of fevers of unknown causes may be faked by those with factitious disorder. So those in the medical field sometimes know how to fake fevers and fake other physical symptoms. And factitious disorder by proxy is most frequently perpetrated by mothers against their babies or young children. Lastly, it's most commonly seen in females, although there have been reports of males having factitious disorder. So here are the risk factors for this disorder. Genetic factors, there aren't any findings that there is a genetic or inheritance factor that causes factitious disorder. However, it does run in families. Next, neurobiological factors. There has been research where researchers have proposed a theory that brain dysfunction may be a factor in causing factitious disorder. So, abnormalities in the central nervous system in many patients have led to this disorder and have led to researchers hypothesizing that this may be an underlying issue that plays a role in factitious disorder. So there has been social and environmental factors found as well that play a role in factitious disorder. So serious childhood illness, specifically if the illness was associated with nurturing and attention. So if a young child has already experienced an illness where they were given a lot of attention, a lot of care, they sometimes crave that and decide to fake these illnesses. And so past relationships with healthcare professionals, this sometimes educates individuals and plays a role in how they go about faking their symptoms. And factitious disorder in a parent or sibling can also cause onset of factitious disorder in an individual. Past anger and aggression with an healthcare professional. And paramedical and healthcare employment. So as mentioned before, these individuals might have knowledge of how to fake symptoms, how to get away with it, and how to properly go about doing it. So the course and prevalence of this disorder. According to the DSM-5, factitious disorder often presents in intermittent episodes. On the other hand, single episodes and episodes characterized as persistent are much less common. The onset age is typically in early adulthood, after hospitalization for a medical condition or mental illness. This is similar for factitious disorder by proxy. It usually occurs after an individual's child or parent has been hospitalized. Those with recurrent episodes and successful deceptive contact, meaning they've successfully fooled a healthcare professional, may have this disorder for life. However, some experts suggest that those with this disorder may experience remission by the age of 40. So some factors that may cause suspicion of this disorder are unusual and dramatic presentation of symptoms. Symptoms are presented exactly as presented in textbooks and diagnosis criteria. So individuals present symptoms exactly as they are listed in the DSM, such as schizophrenia, they present hallucinations, everything that meet the criteria for these disorders. Symptoms do not respond well to treatment or medications. When other symptoms are alleviated, new unusual symptoms emerge. These individuals are eager to undergo evaluations, testing, and procedures. They have an extensive medical history. They have very few visitors if actually hospitalized. And they are reluctant to give contact information or to sign release forms. They may have a career in the medical field. As mentioned before, a lot of nurses, paramedics, and general healthcare providers are diagnosed with factitious disorder because they have knowledge of how to fake symptoms. So factors that may cause suspicion if factitious disorder is imposed in another. So the symptoms may alleviate when a mother or the perpetrator is not present. So a child might not necessarily fake his or her symptoms, if a doctor is present. However, if the mother returns, these symptoms might reoccur. The perpetrator is the only witness who sees the onset of these symptoms. So oftentimes mothers are the only ones who report seeing symptoms in their children. The mother or perpetrator may have a medical or nursing education or exposure to illness afflicting the child or dependent. The mother or perpetrator welcomes painful and invasive tests on these individuals. They are often anxious if the child or dependent improves. If their symptoms alleviate, they often become very worried. And medical personnel often yield information from the child or the elderly patient that is inconsistent with the perpetrator's story. So, factitious disorder is often comorbid with many other disorders, some of these being borderline personality disorder, narcissistic personality disorder, substance use disorder, mood disorders, or anxiety disorders. Some differential diagnoses for factitious disorder are somatic symptom disorder. So unlike those who have factitious disorder, those with somatic symptom disorder do not necessarily fake their illnesses, or they don't behave deceptively. Malingering, so this differs from factitious disorder by the intentional reporting of symptoms for personal gain or reward. So unlike someone with factitious disorder, malingerers often seek time off from work, monetary compensations, time off from school, or other rewards. Next, we have borderline personality disorder, and patients with this disorder may self-harm without suicidal intent as well. However, factitious disorder patients self-harm in association with deception. Anorexia nervosa by proxy. So an anorexic mother or daughter may restrict food from the patient due to fear of excessive weight gain. And lastly, medical condition or mental disorder not associated with intentional symptom falsification. So here are the treatments for factitious disorder. First, there's psychotherapy, and there is also cognitive behavioral therapy. And this is intended to reduce the risk of morbidity and mortality. It's also intended to address the underlying emotional needs or psychiatric diagnosis that may be driving factitious illness behavior. It treats comorbid medical illnesses, avoids unnecessary procedures, and encourages patients to seek psychiatric treatment. And lastly, it encourages patients to be mindful of legal and ethical issues. So this is a brief case of someone who may have factitious disorder. Elle is a 30-year-old female who recently broke up with her paramedic boyfriend, who she had been dating for quite a while. After undergoing a reconstructive nose surgery, Elle began experiencing diarrhea and nausea. After going through extensive evaluations at 2 different hospitals, a cause of her illness was still not found. After a few months, she experienced extreme weight loss and low potassium levels. There was no evidence of bowel issues or other stomach issues. When asked if she had been taking laxatives, Elle denied having ever bought or ingested laxatives. However, after speaking to her mother, it was found that there was more than a dozen empty bottles of laxatives in her closet. So Elle is clearly deceiving her psychologist by saying she's never bought or ingested laxatives when there's more than a dozen bottles in her closet. And she recently broke up with her paramedic boyfriend, who may have given her education and knowledge about the medical field. And usually patients who do develop factitious disorder usually develop it after a major surgery. And Elle had just been through reconstructive nose surgery. So these are the references that I used throughout my presentation. And that's all. Thank you for watching.